Hello and welcome to Salar UpClose. I am Mohammed Yousuf. In this special episode, I speak to Karnataka's Health Minister Dinesh Gundu Rao, who reflects on his impactful tenure from saving lives through the Puneet Hrudaya Jyothi program to implementing India's first right to die with dignity policy. He also opens up about bold reforms in food safety, the role of AI in healthcare, promoting clean energy for public transport, and his strong stand against state politics. It's a candid and compelling conversation you don't want to miss, only on Daily Salar Digital. Thank you for doing this with Delhi Salah, sir. And my first question would be, what prompted you to implement the Supreme Court's 2018 verdict, right to die with dignity, and how different is it from Karnataka's and Kerala's ones?
No, this was an issue which was brought to our notice and by some organizations. And when we looked at it and we realized the importance of it. So those Supreme Court had given out guidelines, but it was not implemented across the country. Kerala to some extent had done something where they've given the process of how you can have this legal form of euthanasia. So we looked at that and then we came out with a proper policy after discussing with the various stakeholders. And so we were the first country to come out with the medical directive. That is, a person can, before when he's healthy itself, he can have, it's like a will, medical will. In case if he's in such a situation, he would not want to continue under treatment. So that is one thing. And second thing, in hospital, when someone is terminally ill and there's no other way, so then we've given a process of how it can be, how a decision can be taken by the family and the medical experts concerned to end the life of the person. Because after that, there would have been no other way of him surviving or her surviving. So this was really a historic thing that we did, and we were the first state in the country to do this. So it got a lot of appreciation.
Yes. With all the appreciations, definitely the Kannada government has got on this decision. But don't you think there's been a legal consequences also in terms of like it can be misused?
No. The process is very, watertight. There's a committee in the hospital which has to certify. Then there'll be another committee which will look at it. So medical experts will have to approve it. So there's a proper process. It cannot just be that someone can just simply, take a decision. So it has got a multiple layered process where it ensures that decision is taken after everybody is on board, and it is certified that yes, this is the right way of doing it. So there's no scope for manipulation in that.
Your department took the initiative of banning the cotton candies, gobi manchurian, and kebabs. So, what are problems did you face while implementing this, sir?
We didn't face any problem. We went about doing our job and we told our people to inspect and check all these things. And wherever there was already some information that we had, those products were checked. And so one was to bring awareness amongst people that this kind of preparation is harmful, and don't consume these kind of foods. Be careful before you consume. And also for those who make the food also, they also realize that they shouldn't be doing these things. So we gave, I think, quite a bit of awareness was given through this, and people became more, before doing something, before buying something, they started questioning it. So that is what we want. The people should become more aware. And whenever you eat outside, you should be careful of the way the food is prepared. So you saw the idlis, they were using plastic to steam the idli. So that is not good. So like that, many other things, bottled water we check, and so many other bakery foods. So on one, we take action against those people who are doing it wrongly. Second thing is to bring awareness among consumers. So our food safety department, I think after a long time, it was seemed to be an effective functioning organization. Yeah.
So the food safety department, they found out that 22 types of metals have been found in the tattooing ink, and you have also sought an intervention for the guidelines from the center, right? So how do you look at this?
That we have written because it is not coming under any rules or any laws. So we have written to Government of India also to see that some laws are made where they need to look into this and see how this can be monitored.
Yes.
So sometimes they use some chemicals which are not meant to be used while they're making these tattoos. So some sort of guidelines need to be evolved So we've requested Government of India.
Okay. So you have also advocated for the electrical vehicles for the public. And how do you see this air quality index? And what is the number of how you're calculating this?
That is just basically in terms of us promoting clean energy, because of course if there's less pollution, then there is less impact on health. More pollution, more impact on health. So how we can do, one is all the electric buses, all those things, electric autos, electric two-wheelers, all these things needs to be promoted. So we've requested the transport department, to take steps on those lines. So it's not that we can issue any orders, but just to ensure that they are on the they will take serious note of these things, because it has impact. Everything has an impact on health.
Because 60% of the pollution is because of those conventional vehicles.
This is the internal combustion engines, all that petrol, diesel, all this. This is in a city. This is one of the main causes. We see what's happening in Delhi now. So Bangalore should not become like that, So we should take earlier steps.
So how do you assess the performance of the hospitals that come under you, sir?
I mean, ours is a public health system. So we have district, taluk, then even at the sub-divisional, and we have these community health centers and primary health centers. Then we have the sub-centers also in villages. So it's a vast network, and there are problems. I'm not saying there are no problems, but it is also, Karnataka is fairly, compared to the national systems, we are much better than most states. But some states are better than us also. Like states like Tamil Nadu and Kerala, they are better than us also. So we need to see that how we can improve ourselves. There is a lot of scope for improvement. So we are working on various aspects of how to improve services, how to improve availability of drugs, how to ensure that doctors are there and present. So all these things we are looking at.
How are you seeing the importance of technology playing into this kind of assessing the performance of such a big network, sir?
Yeah, technology and data management is important. So we are coming out with that health management information system. So it is under trial process in about 4 districts right now. So that is one thing which will be able to, another few months we will be finalizing, so that we'll be able to have data on hospitals and patient records and patients, and even patients will have access to their health records. So instead of carrying all their prescriptions and x-rays and ultrasound, whatever that is done physically, the patients also will have access online, or to be able to store. I mean, they'll have that access to those records. So that is something we're doing. Then we're using technology for treatment, like in tele ICUs in taluka hospitals, linking up with big hospitals in the metros. Then also we're using artificial intelligence in certain things for cardiac care, for detecting lung cancers. So we're using artificial intelligence for there. So technology is going to play bigger and bigger role now.
How much do you think AI will help in?
Yeah, it definitely has got a role to play, because especially in diagnosis, in looking at scans, looking at CT scans, looking at X-rays, looking at say ultrasound scans, and because everything we need an expert to look at it.
Yes.
But the experts are not available in taluka hospitals or community health centers. So those things can be digitally sent to where the expert is. He can take a look, and then he can certify from there. So this is going to play a very big role in diagnosis also.
You use AI into the technology, but then again, you're not completely reliable on it, but you have experts who can give.
Yeah, it has to be two. One is AI can detect.
Yes.
But confirmation should be done by a doctor or an expert specialist. So that is the way we are doing. Yeah.
So you being the minister in charge of the Dakshin Kannada, you also said you accused the fringe elements of inciting the violence to have this political gain. So who are these fringe elements?
There are people on all sides, from all sections, and there are organizations which indulge in this kind of activities. And so there are extreme parties, like you have BJP, you have SDPI. They're all extreme views, ideologies. There are other organizations working under them. You have the Bajrang Dal and all those kind of organizations. So even on this side also they have some other organizations. So these people are with the extreme ideologies. So these are the ones who cause all the problem. So that is what we are saying that uh, whatever ideology they may have, but hate speeches and inciting people, that we cannot allow anymore. So we've taken a very hard stand on that. And right now in Dakshin Kannada, anybody that what was earlier being put on the social media, lot of was being done. Now almost 80% it's come down.
Okay.
Because police have become very strict. So WhatsApp messages and hate speeches and trying to send all kinds of false information, fake news, all that has been curbed a lot now in Dakshin Kannada.
And that is only because you curbed on the social media.
Social media is, yeah, I'm talking in social media, it's been curbed.
Yeah.
And generally now, after all these incidents that took place, where few people have died, everything's been tightened up. So definitely we need to keep vigil, but
So, Dakshin Kannada, places like Udupi and Shivamogga, how are the anti-communal forces doing there, sir? How they are taking the...
oh, they are there. I mean, BJP is a big force in those places, and so the communal elements are strong. So we have to make society more aware that this doesn't help anybody, and we have to create awareness among people that by supporting these kind of elements, they're actually harming our own society. So that kind of thing we have to bring about amongst most people are in the middle, but sometimes they get influenced. So we have to, those middle people should voice out. So we want to strengthen that voice.
So, how are you planning to aware this to the people, sir?
By all our actions, and we had a peace committee meeting recently. We had called everyone, various organizations, and all various agencies, and political leaders, business leaders, educationists, and we had this peace meeting in Bangalore, and it went off very well. So try to build that voice.
So, the Shuchi Yojana, how is being taken by the students, sir?
No, that is it was there even before actually. In middle for 4-5 years they had stopped it. So we came back and we restarted. So
How's been the response?
response is good. I mean, of course people want, but we want girls to start using the menstrual cups more, because that is less impact on the environment. It's more hygienic, and it is also practical. And so this is what we are trying. So we've done it in 2 districts. So this year we want to see if we can do it more.
After you came, you have done counseling transfer in large numbers in health and welfare department. How did it come in, sir?
Well, that is to have transparency in administration, and the people who are going to get postings should get based on certain criteria, not because of their influence. So for the first time, we have done these transfers through counseling, and almost 5,000 plus people have been transferred based on the need for the transfer, and the choice is also left to them. So it's a choice-based transfer. So it is a very transparent process where they have to go through the system. So it doesn't need anybody's influence or recommendation or anything. So many deserving people who don't have influence, now they've got opportunity. So, and many people who are undeserving but had a lot of influence, they have been forced out. So it has not been an easy exercise, and we've done it for the first time. I think there have been some issues there, but I think by next year when we do the transfers again, that also would have been sorted out.
Okay. And coming to 108, you have taken the initiative to run the 108 on from the government itself.
Yeah.
Were there any problems or challenges you faced when coming out of this?
No, there's been no problems right now. We are in the process of transition. So the existing agency is running it, but we are now slowly, we have already floated the tender for the command control, and then we will be floating tenders for the service contract.
Okay.
So it will be managed by the government. The command control will be in the complete control of the government. Of course, we'll be having an outside agency to run the center, but it will be under the control of the government. And so that is the most important part, the command control center. Then of course the services, that is the ambulance driver, technician, that will be done in all districts. So this is, I think, it will be a very unique model in the country, and hopefully it will improve the services. That is what we want.
Your tenure as KPCC President from 2018 to 2020 was not an easy one. There was a change of government and you also resigned in December 2019. Thing. And after the party lost in the assembly, how difficult was it for you, sir?
I resigned when our government fell because of the defections that took place. And then after that we had the by-elections, and in the by-elections we were not able to win those seats. So I took moral responsibility for that. But after that, I mean, it was a difficult period, like you said, and so many things happened, operation and this, that, all that. But ultimately, after that, we all worked together and we come back.
You had a legacy of being son of a former chief minister. So you have any plan to groom someone from your family or to have a hire?
Right now, there's no such thing. I think it is no such plans is there from anybody. But I don't know in the future. But right now, as of now, there's nobody who seems to be interested. So I do not know for sure.
Sir, last question. You came up with this hookah ban and kebabs ban and all that. What challenges? Like definitely you must have faced challenges because it's in large numbers. The business is in large numbers. It's on the streets.
Yeah, I mean, people went to court, all that,
Yeah.
and the court stood by us. Our tobacco policy also as one stood the test of law, and we made amendments. So all those things we were able to do, and there were some people who tried to pressurize, but since our stand was very clear, so we actually we didn't face that kind of any problem as such, and I don't think anybody came out publicly in support of this, saying that you should allow for hookah bars or you should allow for all these things. So it was, I mean, we were very clear about what we were doing, so that's why we didn't have any problem in executing it.
Most of the opposition was behind the curtains.
It would have been, and since we were not obliging anybody, so nobody could come out publicly and say anything. Though through legal process they tried, but legally also we won the case.
Finishing off this one last question. What is the most satisfying program you did since the time you've become health minister, sir?
I don't know if you've done many programs. I think
Believing that when we do some work, right, we are very much passionate about it and we love it when it happens. So any one of the programs that you recognize?
I would say, this Puneet Hrudaya Jyothi scheme, that has worked very well, and it has been able to save lives. More than 200 lives we've been able to save, because it catches a cardiac arrest from happening early. Early detection happens, and we're able to provide them free treatment, free injections, and expensive treatment is given free of cost. So many people who are getting cardiac arrest, when they come to know, or if they're in the process of an arrest, say the artery is blocked, then by the time they reach the hospital itself, they die because there's no blood flow. So those kind of things we've been able to do it at the taluka hospital level, so that by the time they reach a district hospital, they'll be fine. So these things actually have saved lives, and that I think has given me a lot of happiness.
Thank you for doing this.
Thank you.